The Virginia Cable Telecommunications Association and your local cable provider presents Cable Reports. Join us now as Cable Reports brings you up to date on current issues facing the Commonwealth through discussions with your local legislators and other policymakers from across Virginia.
From the General Assembly and the City of Richmond, I'm Woody Evans for Cable Reports, brought to you by the Virginia Cable Telecommunications Association and Comcast, connecting Virginians to their government. We're pleased to have Delegate Mark Berg here with us this morning. Good to see you, sir.
Yeah, thanks, Woody. It's good to be here talking to you.
A very fast-paced session so far. You've got a lot of things in the hopper. But first of all, tell us a little bit about your district in terms of its geography and how diverse it is.
Well, Winchester, Frederick County is up in the northwest part, as far as you can get northwest in Virginia. And it's mostly rural. We've got a couple towns in the Winchester city itself. And it's a very beautiful area of the state, actually, I think one of the nicest. Not so affected by some of the issues that make the headlines, not so affected by the transportation issues as far as the overcrowding on the streets, the wait times, etc. But we do have some transportation issues related to funding of projects that are now on hold, and that's an issue. As far as some of the issues related to employment, etc. Again, my area luckily is doing a little bit better than some areas of the state. Of course, you know, in the Southwest there's significant problems with effects on employment because of legislation and just what's going on in the country in general. We're a little bit isolated from that, and we're not so dependent being to the west. We're not really wrapped up in the Northern Virginia issues with federal government jobs. Although we do have a lot of that, we're not quite so dependent on that, so we took a little less of a hit along that line.
What about real estate? How has it done?
I talked to some realtors not that long ago, and actually it's improving a little bit. They're seeing some positive signs, so that's good.
So what drives the economy in your district?
Well, there is a fair number of people that travel out to Northern Virginia. It's a significant amount of that. And then, of course, we have the Winchester Medical Center that is a huge employer and very important to our economy there. And, of course, education anywhere is also a big employer and very important. And that's always related to the funding that you get in Richmond and how that's going to impact education and everything. So that's tied in there.
Now, you mentioned the rural nature of your district. Is there much agribusiness, small farms, large farms?
There is a lot of agribusiness. I'm not sure of the exact statistics off the top of my head, but I've heard that and I'm aware of that. And it's a significant, has a significant positive effect in the area of Northern Virginia.
To what extent, if any, if you know, do any of those agribusinesses export internationally?
I'm not familiar exactly where the exports are on that. Obviously, as it relates to what's going on in the state, that's a big push by the administration to try to get our products from Virginia out elsewhere. But I haven't seen anything directly related to that that's been any change, so I'm not aware of it.
So health, that institution you mentioned, the medical center, is a fairly large employer in your district?
Yes, very large employer.
To what extent has it been impacted by what's going on at the federal level? We had talked earlier about the impact of the Affordable Care Act, Obamacare, on the medical institutions in general and practitioners in particular, as you were at one time. To what extent has that institution been impacted?
Well, that's constantly impacted. Every week and month, I'm sure the administration of the hospital considers some factor that's related to Obamacare or some federal mandate or state regulations. In general, hospitals, you know, are becoming more of the primary care providers in a sense. They're taking on private physicians, and there's less private independent practices. I don't necessarily think that's good to centralize that, but that's the nature of the dynamics are making it go that way. Hospitals always have to worry about funding and Medicaid issue and whether we're going to have expansion or not is a huge issue there. Very complicated. If you're going to get Medicaid expansion, then you may get some more money in one area, and now you don't need some other federal, state funding. Until you make those changes, it's kind of difficult probably for the hospital administration to know exactly, but it's constantly changing, I think.
And I think you're one of the few people who has waded through the 2,700 pages, I believe, of the Affordable Care Act. Yeah. So you know in some detail the problems with that law. Mm-hmm. Talk to us a little bit about that, especially in relation to the debate that ensued last year and to a lesser extent this year of Medicaid expansion that you mentioned.
Well, as you probably know, Woody, the state has the ability to expand Medicaid on its own, add programs. Not all the 50 states have the same programs. They have the minimum mandatory programs, but they can add other ones. When we're talking about the Medicaid expansion, we're talking about the Medicaid expansion under Obamacare. We're talking about that section. And that's estimated to be various hundreds of thousands here, mostly 400,000, you've heard the term. And the problem with the Medicaid expansion under Obamacare is the state would have to comply with all those little details, and there are many, many details in Obamacare. So it's not as simple as just saying we're going to specifically help one group of people. You have to take the whole package under Medicaid expansion under Obamacare, and it's very diffuse. I mean, it affects a lot.
So how are indigent patients getting the care they need in your district?
Well, it's interesting, Woody. We have a free medical clinic that does a lot of care, provides a lot of free drugs, some of which they get obviously from the pharmaceuticals, and some very expensive drugs. A lot of volunteers, they do a great job. They don't take people that have insurance or that have Medicaid. So, for example, this is one of the problems I have with the Medicaid expansion. If those people sign up for Medicaid, or even if they get signed up by the government, which can happen when they're found to qualify, they get signed up for Medicaid, they would go down to the free medical clinic expecting the care they've had, the ongoing care, and they will not be able to get that there. They will no longer qualify to go to the free medical clinic. Now, as you know, if you're going to have a lot more people on Medicaid, you have to have the physicians that would take care of them. Right now, we have a shortage of primary care physicians in general that would treat those kind of people, and you could never ramp that up quickly. So you're going to have people turned away from our free medical clinic, and where are they going to end up? Not in a doctor's office where they'll get continuity of care. They'll end up in the emergency department, which is exactly what you didn't want.
Interesting. Well, I know you've got quite a bit of legislation you're pursuing this year.
Yes.
Let's talk about several of them. I think there is one about children and the use of communication systems to facilitate certain offenses. Talk to us about that one.
Mm-hmm. Well, someone in my district had mentioned a case related to that about their daughter having some problems with communications, electronic communications, and being harassed in a sense. And so I looked into the code sections, and it seems that there are not good reporting requirements for solicitation of minors. Now, the actual crimes, for example, if you solicit a minor for some sexual offense, some sexual act or something like that, the crimes are there, but the penalty for soliciting for that crime, in a sense, was not there in a few areas. So that was prompted the bill.
So this is something, for example, a youngster who's using social media, and you have some predator who's able to solicit that youngster over the internet.
Right.
Okay.
Right.
Okay.
Now, that bill, I'll be talking to someone who's an expert in that area that I've come across in my talks here about other bills that I've had. And that bill hasn't come up, and that might need a little bit of work to make sure we get the people reported to the right agencies. Make sure the first agencies that you want to have primary responsibility would have that responsibility. I haven't specifically talked about that yet, but that bill's not on the docket yet. But,
it's assigned to a committee, however?
Yes, it is.
And what committee is it assigned to now, if you recall?
I can't remember right off the top of my head.
Now, what about, again, there's another one dealing with child abuse and neglect and the necessity for mandatory reporting.
Yes, and the person I talked to about that is the same person I need to talk about this issue of crimes against children. And that bill has been heard in subcommittee, this bill on the
Child abuse and
child
reporting
abuse and
requirement.
neglect. And it was prompted by the Attorney General's ruling on a case of a 14-year-old that was pregnant, that mandatory reporters don't have to report that specifically. Although, in the vast majority of the cases, a 14-year-old that would be pregnant quite likely had a crime committed against her because
Exactly.
because of the statutes that are already there.
Right.
So Attorney General Herring said that it wasn't a mandatory reportable offense. So that's the issue I want to address. Now, to get into the specifics, again, it gets back to if you make that report, where exactly it goes such that the most important agency has first take on it and does what they need to do first, and then you get follow-up in other agencies that could provide additional sources. So that's the issue that I'm working on right now, and that had gone through subcommittee, and it will come up in subcommittee next week. So hopefully we can work it out before then and get a better bill.
So we're talking about mandatory reporting that may involve dealing with Child Protective Services, for example, and potentially law enforcement. As you indicated, if a 14-year-old is pregnant, obviously there's a crime there.
Correct. And that gets to the crux of the issue about the reporting. It has to be worked out exactly where it would go first and make sure that one agency doesn't interfere adversely with the other agency,
Right.
and make sure that things get done in an order so it's effective. And that's what I'm still working on.
Right. And I know you're an advocate of privacy, especially
Yes.
relating to personally identifying information.
Yes.
With reference to our schools and our children, talk to us about that and why it's so important.
Well, as far as the schools go, there are increasing reports. If you just follow it on the internet and you're interested in this, you'll see many, many instances where parents are surprised that their children's information shows up somewhere where they had no expectation. And even the parents didn't know that that information was being collected. In fact, there is a bill right now that I was just in the subcommittee, and one of the delegates is addressing the issue of information, private information, that would be on surveys, and that the parents need to know about that survey and what it's asking, so they have an understanding of what kind of private information would be collected, and then how that would be used. That's just one example right here, but across the country there are many, many examples of vast amounts of information that's being collected on your children, and they're not really aware of it, and there are not really any safeguards. Not any safeguards, but not good safeguards to protect that information so it doesn't get sent where it shouldn't, and even to not collect it if you don't really have a good reason to do it.
So what would your legislation do in that regard?
My legislation is based on a bill that was introduced in Georgia last year. It was written by some experts in the area and had been modified since. It didn't pass in Georgia, but it really delineates what kind of information you would want, and specifically where the information would go and why you want it also. Not just saying, well, we'll collect this information and just providing information to the parents, here's what we do, but limiting the fact that you're not going to collect the information if you don't have a good reason for it, or if it's not already in statutes, for example, already. If you had a good reason to get information, and there are a lot of good reasons why you want student information, many reasons, they are addressed in various statutes right now within the state code and also in federal. And my bill exempts that so that those legitimate reasons to get it that have already been encoded in statutes is allowable. But when we come to new issues and new information, you have to say why you want that information and where it would go.
I see. So how has that legislation been received by your colleagues so far?
I haven't got a lot of feedback on it yet. The legislation I'm following that's really keeping me busy is related to some of the same issues, including in that subcommittee, about health information and other privacy information. So I'm trying to get up to speed with similar bills or related bills to understand where everybody's coming from, so we don't have to duplicate our efforts.
I see. The subcommittee work is obviously very important. Talk to us about why it's so important. I take it, given our conversation, that if you don't get your work done in subcommittee, the chances of your bill being successfully passed is slim or none.
That's correct. Most of the work is done in a subcommittee. Some bills are straightforward, get passed out of subcommittee with no opposition and no abstention and come out of committee that way. Those bills get on a uncontested calendar, and they're not vetted, I would say, quite as well on the floor because they've gone through several layers and they have already been vetted. Most of the work is done in a subcommittee, and that's where you'll have people come in and speak to the bill from outside and offer their input, and the delegates will be able to debate it. And if it gets through the subcommittee, it still, of course, has to go through committee, so there's another layer of vetting. So, but the most important right off the bat, obviously, is making sure people understand in subcommittee.
And as an original matter, if you're the sponsor of a particular piece of legislation, it's your duty and responsibility to speak to that bill and defend it in subcommittee and committee and on the floor?
Yes, yes.
And then do you have to repeat that process once your bill goes over to the Senate if successfully passed?
Well, there's a couple bills that I have that were introduced, very similar ones in the Senate. So that would have already gone through their process.
Right, okay.
But otherwise, when it goes to the Senate, if they haven't done that, then they kind of have to start anew and look at the bill, and it could be amended, or they could have problems with certain sections, and it's much better if it's in both sides, but you can't get all bills in both sides of the houses.
Now, I know you're a real advocate of Second Amendment rights.
Yes.
And there's some legislation you have concerning concealed weapons. Talk to us about that as well.
Well, the underlying principle that's important to me is that unless any government, state or federal, has some very good reason, a pretty high bar, to take away a constitutional right that you have, then they shouldn't do it. It shouldn't be done frivolously. It's a very serious issue, constitutional rights. Not just Second Amendment, but First Amendment rights, exactly the same analogy. So that's the underlying reason that I've put in some of these gun bills. I have 4 pro-gun bills, but they're all related to the same general underlying principle. If you are going to deny me the right to carry a concealed handgun, for example, that I might want to use to protect myself, and you're going to put some limit on it in a certain area or some other kind of limit, you need to advocate and proactively tell me why you should put that limit on what would otherwise be my right to carry.
And so there's a bill that has to do with concealed handguns on school property, possession on school property.
Yes.
What would that one do?
That would allow for after-hours functions at a school. It would allow people going to that already have concealed handgun permits to continue to carry in that venue. There's a lot of misconception, and this is very controversial, it seems, but people have the idea that this would, for example, allow people to carry, students to carry in, for example, the chess club after school or cross country or whatever. You have to realize that you cannot get your concealed handgun permit until you're 21. So we're not talking about arming students whatsoever. That's not possible. What we are talking about is, for example, allowing people that are already concealed handgun permit holders that may go to school, to a school building after hours at 7 o'clock for perhaps a photography class or any other function that may not even have any students in it, to carry their concealed weapon in that venue.
Now, you mentioned a number of other pieces of legislation you have pending. I've seen one that would allow for, in essence, a lifetime permit of a concealed handgun permit. As I understand it now, you have to reapply every 5 years in order to retain the concealed handgun permit. Would you be in favor of something like that that would allow for a lifetime permit?
Yes, I definitely am in general. That bill is being carried by, was put in by another delegate, and I don't know if it had been changed or amended in subcommittee yet or whatever, but I'm following that. I would be for lifetime concealed handgun permits.
Now, you mentioned significant hurdles to be met if one wants to impose any restriction on the Second Amendment right to bear arms, and I'm sure you're familiar with the Heller decision out of the United Supreme Court in D.C., and I think Justice Scalia talked about reasonable regulations would still be permissible. You mentioned the First Amendment. There are exceptions to our freedoms of speech, so to speak. What kinds of regulations, in your opinion, would be permissible? For example, let me give you an example. For concealed carry permits. I understand you have to take a course. You don't have to demonstrate, I don't believe, any proficiency in the handling of a firearm. Would that be something that would be reasonable in your opinion, in order to obtain a concealed handgun permit?
That would be, I would have to see what kind of legislation. In general, I wouldn't use that as a bar to mandate, because there's any number of people that would be qualified. You get into areas where you already have people that have carried guns for a long time, they're ex-military, they're law enforcement, and people would say we can exclude those people because they know. You've had people that have been handling guns in various documented ways for 30 years, and you might not want to have them end up having to pay $50 to show that they know how to handle a weapon. So in general, I'm not for that blanketly. As far as training, obviously, law enforcement gets training. If you were to have teachers carry in a school, for example, you would want training for them above and beyond, I would think, the concealed handgun permit training, because they would be in a function of protecting other people, almost in a quasi-law enforcement nature, and not just protecting themselves, like I might with my concealed carry permit, but they would be responsible for public people, students. So there are reasons to do that. In addition, there's reasons why you don't want to carry some places. You don't want to necessarily carry, in my state agency bill that addressed where you could carry state agencies, would not allow you to carry into courts or areas that are already specifically defined and where there's good reason not to carry. There are good reasons not to carry in some areas, for example, in judicial buildings, for example.
Right. So. Well, we'll continue to look at that. Let's talk about education a little bit. How are the schools doing in your legislative district? To what extent have they been impacted by the whole debate around the standards of learning?
Well, that's very controversial. I mean, you have teachers talk, administrators talk, and then the legislators, and they're trying to work this out between those three major categories. As a basic issue, you have to have some standards. You cannot have no standards. So you have to have some standards, but you don't want them too burdensome and too top-down heavy. This came up last year with the requirements for SOLs, for example. We had cut back the number of testing episodes, but it got unwieldy. It's easy to, unfortunately, add on new requirements slowly, and it's not just in education, but add on requirements to an agency or a bill, in a bill to agencies or private industries. It's easy to add on, and at some point you have to step back and say, we're too top-heavy, we're regulating it too much. And that is a very, gray area. This is why this is constantly an issue. You have to have some regulations, but I think we did have too much. In general, I feel that the localities and the local school boards should have more say, I believe, than the way it is now. I still think it's a little too top-heavy, and that would include right up to the federal level. I don't believe the federal level can do an adequate job trying to say Virginia should be the same as Alaska or Texas. So that's way removed from what I think is the best situation, and that's more local control.
So people at the local level have the ability to make decisions for their locality and their citizens. There was a bill last year that was declared unconstitutional, I believe, by a court in Norfolk, which allowed the state to take over a quote-unquote failing school district. Apparently it's dead as a legislative matter. You can correct me if I'm wrong. And then there was the bill that purported to grade school districts on an A to F scale. Where do those things stand now?
I haven't seen the outcome of that, but that's in legislation this year. If it's in subcommittee and it's not something I have time to get to behind my others, I'll not necessarily see it. One of the downsides of having a lot of legislation, and a lot of it's very important, but you have limited time to catch it before it gets to the floor. Certainly I like to see, if I can, the legislation that's important to me or to my community by the time it's in subcommittee, so I can have a little more say on to talk to the delegates and see if there's an issue that has to come up. But sometimes you don't end up seeing that till it gets to the House.
Now, have you heard much from your constituents, however, about taking over local school districts, being able to determine how your school district is doing by some type of criteria, at least?
I haven't heard specifics on how they want, for example, ATEF
Right.
grading to go. I know there are other issues that are important to localities in the schools. For example, when you're talking about education choice, which I'm for, there's the issues about charter schools and how
Right.
they get approved. Interestingly, that is technically a local issue because of the way it's written now, and the local school districts have the ability to have a say on the charter schools, for example. That is the one area where I don't think that's appropriate because it's kind of a conflict of interest to a competing school versus another for one to have the say over the other. So I think there the state has to take an effect and oversee that. That would be the same if you had any dispute between localities on any issue, and it couldn't be resolved without the locality favoring one or the other, and the state has to come in and set some guidelines. So that's one exception to me believing that most everything should devolve to the locality if you possibly can.
Right, right. Another hot button issue that you're dealing with this session has to do with ethics reform.
Yes.
It's a result, apparently, of a public perception, given the conviction of our former governor and the need to change the rules that you live under. There's the need to define terms more explicitly. For example, who's a close personal friend, who's a relative.
Yes.
Also, the difference between an intangible and a tangible gift that certainly many people don't understand. But in any event, tell us how you think that's all going to come out.
Well, I think there'll be fairly significant changes, so in the sense that it'll be more specified what you can and can't do. Most people aren't aware that Governor McDonnell wasn't specifically charged with any violations of state laws.
It was under federal law, yes.
Yes, so people get the misconception that, oh, he did this specific thing and he should have known. It's not even... it wasn't even addressed. It wasn't brought up as an issue for Governor McDonnell that he did that. It got into the federal areas much more, as you just mentioned, and who among us are experts on every area of the federal legislation? Now, as a legislator, I should be aware, as I possibly can be, about federal regulations on ethics, etc. But even that is a gray area, and the law is being set through the courts as court challenges are being brought, and you can be absolutely fine with what you're doing, have no qualms in your own mind that you're doing anything that would be a problem. And in fact, it could be a problem.
Great. Well, we'll leave it at that. Thank you for being here, Delegate Mark Berg.
Okay, thanks, Woody.
Thank you for watching Cable Reports, brought to you by the Virginia Cable Telecommunications Association and Comcast, connecting Virginians to their government. Until next time, I'm Woody Evans.